Good afternoon, everyone, and welcome to our Wednesday, August 20. What day is today? 28th. August 28th, 2024 work session, afternoon work session. This afternoon, we, the commissioners, are convening as the Board of Social Services, and our topic is to get an update from our Human Services folks, a variety of areas, and some of the good work they've been doing in the community. I think this is a quarterly update. So with that, my name is John Kafalis, Commissioner from District 1, currently the Chair of the Board of County Commissioners, joined by my colleagues, Kristen Stevens from District 2, and Jody Shedek McNally from District 3. Also, we have our County Manager, Lorenda Volker. And before we turn it over to our Human Services folks, Lorenda, is there anything you'd like to say? Then we'll turn it over to Heather. Welcome, folks. Welcome, colleagues.
Thank you. Good afternoon. Again, Heather O'Hare, Human Services Director. So you have before you a packet of all of our materials that's also been posted online. So for anyone listening, they'll be able to follow along. Any additions before we jump in?
I had mentioned earlier that it would be I think it would be helpful to get an update on some of the CBMS, Colorado Benefits Management System discussions that have been happening at the state level, and also the county administrative funding, which apparently is included in the agenda.
It is. So we can touch on the CBMS when we get to that portion.
Very good. Thank you.
Okay. So not in addition to the agenda, but there is one additional material that we provided to you. So with the Alexander Mountain Fire, this was the first time that Human Services had such an active role in the response. And so we wrote an article for our internal staff, just highlighting the work. We had about 20 staff total that were redeployed to help with emergency management and the setting up of shelters, evacuation of animals. So we just provided that article so that you have a chance to see the great work that was done under, Joe Mosh and Gordon Coombs' leadership. So that's in there, but it's not on the agenda. So we will start, I'm actually going to hand it over to our child welfare team. They'll do introductions as they start with their presentation, but wanted to present you the updates of the prevention grant that we've had for 5 years, give you an update on that as that activity is coming to a close. So I'm going to turn over to Thad.
Thanks, Heather. Thad Paul, Division Manager, Child, Youth, and Family Division with the Department of Human Services. I'm not going to do much talking. I'll let the experts of the program do the talking over here. Long story short, as Heather said, we are coming to a close on the 5-year federal grant. We've been in front of you a couple different times on this, and we are in partnership with the Social Work Research Center to do an evaluation on this, and so we're really excited to share some of the preliminary things that we're seeing and findings that we're seeing from this work. As a reminder, we were one of 9 sites nationally to get this grant when we applied, and fundamentally the reason I think what's most successful is that it's both connected to the work in child welfare, but we hired people with lived experience that are delivering the service in the community. So it's coming from the people that the people that are serving are the people that are like them and have the same experiences with them. So I think that's the best part. We have a video, so we're hopeful that we'll have enough time to show you a little snippet video. It's short, 4 minutes, of each of our navigators, because it's those amazing people that work for you guys that we want to really highlight a lot of the amazing work that they're doing. So if you wouldn't mind, while we're doing the presentation, if you could hold the questions till the end, just so we can gauge some opportunity to see where we are timing to be able to get that video in. All right, I will turn it over to Deb.
Thank you, Thad. I'm Deb DeLuca-Forsley. I'm the program manager that oversees Supported Family Stronger Community, which is the title of our community collaboration grant. Next slide, please. And the next slide, please. So quickly, as Thad mentioned, we have been in front of you prior on a couple of other occasions, and so I'll just do sort of a reminder of what the work of this grant is all about. So initially, the grant overall was really looking at how do we reduce child maltreatment in our community. So that was the overarching goal. The way that we decided to take this on was to look at it from a multi-level standpoint. So we are looking at how do we provide early intervention and support families to prevent child abuse from ever happening, as well as helping our community partners better understand that there are potential options to help families prior to ever having to call child welfare. In our community, it's pretty common that when our partners and/or others in the community see a family in need and they're not certain, the go-to has been to call the hotline or to call child protection. And we all know, as good as the folks that work in this division are, that that's not always the best and/or first place that families should be referred to. So we were really looking at how do we gain trust in our community and gain trust with families to know that there was a service to support them when they were in need. We also worked at a level of partnership with the community to say, how do we assure that we are working together as best as possible to serve families across this community? So how do we know that we're sending families to the right resource? How do we know what might be required of a family if they go to apply for something so that they're there and they know what they need? And how we work together better to prevent child maltreatment. We have utilized, in terms of our partnerships, we have a bi-monthly navigation meeting that is a community-wide partnership that looks at how we serve families as a community. Our team hosts that, but it's a community event. We have a community collaboration team that oversees this work that meets quarterly at this point, as well as Thad mentioned, we have Colorado State University School Social Work Research Center looking at outcomes and data and keeping track of that for us. And lastly, as Thad also began to mention, is that authentic family engagement. Our goal of this project has been to say, how do we truly engage families with lived experience into this work to tell us what they need versus us telling them. We hired navigators with lived experience, which was probably one of the most and beneficial efforts in this work. And it was very specific to how we searched for those folks and got to be able to hire them on the project. Next slide, please. So as I mentioned briefly, what we're trying to do is introduce the idea of a warm line. Instead of having to call a hotline, where can community and families themselves, we do have self-referrals that come to us, and our community partners, where can they go when they see a family that may need support or resources, but not have to call into the hotline? We also, as the navigators, that's the title, they are called community navigators, there's 4 of them. Their role is to meet families in the community where they want to meet. That may be in their home, that may be in the park, that may be in a coffee shop. It is wherever they want to meet and wherever they choose to meet. That also means in doing that kind of navigation work, they will sit down with the family and potentially help them fill out a peak navigation. I have bilingual navigators, which you'll hear about in a minute. So if their primary language is Arabic, he can help fill out the forms in Arabic because they do not come in those languages. Same thing with Spanish. They don't translate well into Spanish, and oftentimes those words get confusing and they can't understand them. So they will literally sit side by side and help fill out applications for benefits or services. We also look at what's the best way to meet with them. They use the variety of tools such as texting, phone calling, emailing, in person. It is truly driven by what best meets a family's needs, and we let them tell us what it is that best, how to best communicate with them, how to best meet with them, and how to best serve them and their family. Again, as we mentioned, we have bilingual and bicultural navigators, which you're going to hear about. So I have been fortunate enough to be able to match those with particular languages or cultural backgrounds with navigators that best meet their needs. That has also been something that's unique to the work that we've done in the past, and feel really lucky that we've got that as an opportunity for our community partners and our families to be able to be met at a level and in a cultural way that best meets their needs. The 4 of them come with lived experience. So when they sit across from them, say a family, and say, I understand what you're going through, they really actually understand. And that is different. I think we all want to understand, but if I haven't lived it, I can't say that I understand it in the same way. Again, it's based, the services that families receive is based on what they say they need. Next slide, please. As I mentioned, the partnership, so Colorado State University has been maintaining a Qualtrics database system for us to keep track of the referrals that we send to our community partners and across our community partners. So as of the end of June of 2024, over 4,000 referrals have been made to community resources between our partner agencies, and that just includes those that have been a part of this project. That's not obviously the whole community, but there are so many agencies that partner with us now as we've worked through the 4 or 5 years of doing this work. To see us have that many referrals back and forth to each other really speaks to that work we've done to collaborate more effectively with each other. We are also able, so far, we've never had a wait list. We are able to serve families in a way as a team that has never had a wait list for families. And we know we partner well with our other agencies in the community that provide similar services, and they often are on wait lists. And we luckily have been able to work together to triage, to find other avenues to potentially meet families' needs that we've never had to have a wait list for a family. And we feel really good about that since there's only 4 of them. The eligibility for receiving services is literally that the family lives or resides in Larimer County, that they have a child under the age of 18. Doesn't matter, documented, undocumented kinship makes no difference for us, and that they don't have a current open child welfare assessment or case. So those are the eligibility, which opens up a lot for us in terms of what families may be able to receive these services. And as I mentioned previously, we're working really hard to make sure that families are connected to the right resource from the very beginning. We heard very early on that if families go to an agency or a service and find out that's not where they need to be, it's unlikely that they'll go back. It's frustrating, it's overwhelming. And the last thing that I'll mention in terms of my part of this information sharing with you is we have been utilizing what's called the Protective Factor Survey, the second edition of the survey, which has been used for a number of years. The reason we've chosen this Protective Factor Survey is it's very family-friendly, it's very strengths-based, and it drives what it is that families choose for us to have the support in helping them navigate in our community. And I'll turn it over to Katie.
Hi, Katie Heckman, Deputy Division Manager with Children, Youth, and Families. I'm going to present some, I think, pretty exciting research that we've been able to get so far from our CSU partners. So next slide. This flow chart that you're going to see first is an illustration of the number of basically engagement in the program. So the first number is the number of referrals to the navigation team, and these numbers are current as of June 2024. So 728 referrals received into the program. 627 of those were screened in. 559 were successfully contacted, and then these bottom buckets are the different programs within the unit. So high intensity, light intensity, and community connections. It's some sort of interaction with the prevention team. One thing that we're excited about is that this means that we have about a 75% engagement rate with the referrals that we're receiving. And as we've done more communication and collaboration with our other state collaborators and people who are doing prevention programs, our engagement numbers supersede most programs. And I think that's due to a lot of different factors, but it's something that we're really excited to share with the rest of the state, why and how we're seeing that success, and hopefully we can help implement that into other programs. But that's a really exciting part of these outcomes so far. Next slide. So this graph, first I just want to focus on the blue bars. So the blue bars are showing the average protective factor score. So when a navigator is going out and completing the protective factor survey with a family, they're scoring themselves in each of these categories. The lower the score, meaning the more assistance they need in that area or are wanting in that area. And then the gray is showing the average number of referrals made per protective factor. So I think what's important to see here is that we're connecting families with the resources that they're asking for. We see that concrete supports is a big need in our community. That includes rent, that includes housing, that includes transportation. That's what families are saying they need the most, and that's where we're making the most referrals. So I think what this says is our program is matching people to what they're wanting and needing. Next slide. So this chart is showing the difference. So the navigators are doing a initial protective factor survey on or about the first visit that they meet with families, and that's really getting a gauge on where they're needing help or assistance. And then they're also doing follow-up protective factor surveys throughout their life of work in this with the prevention team. And so this is showing change over time in protective factor survey. We're seeing an increase in the protective factors as they work with the navigators. The social supports and concrete supports are significant changes over time. So those ones we're seeing really significant increases in. Family functioning and resilience is also highlighted. It's not quite yet statistically significant, but it's getting there. So these are the 3 protective factors that we're seeing the most progress in. And last but not least, this crazy graph. So this is showing basically each line represents a family, and then we're smushing them all together. And so on the, yes, the left side of the graph is showing before any sort of interaction with the navigators, and then the right side is afterward. And this can be any type of interaction, whether it's community connections, high intensity, low intensity. And what we're seeing is a downward trend in the likelihood of an assessment after contact with the navigators. So after any sort of engagement in our program, families are less likely to see an assessment with child protection.
And I think
Maybe let me
go
jump
ahead.
in there real quick. I think that trend, so in essence, that trend line on the left side is the likelihood of them coming in and in a future state, right after, if we didn't do anything. And then the one on the right is basically the trend line that happens after we become involved. So you can see a pretty drastic difference on the slope of that trend line. There's also another comparison that is coming, and I don't know if we'll come back to you in a future state, but we would for sure share the research when we get it from CSU. There's some indication, they're also doing a study across other county zip codes to see what our impacts are, and the initial indications are the CSU actually thinks they are seeing some statistically significant differences in our programming compared to programming in other counties across the state, and to the point that this is likely a publishable program that we'd be able to publish in all peer-reviewed journals, which is really exciting.
And the only other thing I wanted to just mention really briefly before we watch this short video is back in 2011, we started differential response in this community as a way to partner with families and create a less adversarial system, so that we really were looking at families and they as the experts versus the professionals as the experts. I really feel like, and when we've talked about this across the community, this effort at prevention is helping us move and taking us to a different place in this community and evolving to a much more family-centered approach. And to see the results that we're getting from our evaluation as well as the feedback, we are really, truly moving in that direction, I feel like, for the first time in a really long time.
So the next piece we have is the video. My thought is we can do the video and then open for questions, but we do have, we're looking okay on time, so we can do it either way, whatever makes sense.
What is your sense of the dialogue that we'll have after the video? How much time makes sense?
We have, we had planned to spend another 15 minutes on this, so
On
that
this
would give
Video's
us,
only 4 minutes,
at
so
least
that should
10
give us
for
enough.
That's helpful, because I suspect we'll have some questions and feedback. It's a very interesting presentation. Thank you.
Yeah.
So Mary is one of our navigators that is bilingual, and so she has an incredible connection to our Hispanic, Latino, Latinx community.
She's very open about her story and makes people feel comfortable.
Well, my background is I'm a single mother, and I'm also a single grandparent raising 2 grandkids. I've been through unemployment, I've been through homelessness, I've been without transportation, I've been without work. I've had adult children who have been in and out of jail. You know, name it, throw me something out, and I've been through it. I've related with a lot of Spanish-speaking families, and I've been able to talk with them in their own language, and I've been able to connect with them because of our culture, you know, to meet with families and to have them, you know, be welcoming to you and connect with you and let you into their vulnerability. Life happens. Stuff happens. So having a family understand that it's okay to be where you're at and to ask for help.
Tomas also is bilingual and is very connected to his community as well.
Before coming to us, was already a leader in the Latinx community in Loveland.
Basically, I came as an exchange student. A problem in my visa, I became undocumented. After some years, I became a pastor in our community over a Spanish-speaking church. It has made me understand the families, where they're coming from. And sometimes all they need is just a little help. In social work, sometimes success is defined by the caseworker or by the court. But actually, when the family has a success, for example, it could be, stop smoking, and that was a big step for the family. So it's really up to the family to determine what that success means.
So Rod is Arabic speaking.
He knows how to meet people where they are, is extremely approachable and gregarious.
I'm from Iraq, born and raised. I was a medical doctor in Iraq. I worked there for a little bit, but then I had to leave the country because of some circumstances related to war. For me, as a refugee who came from Iraq, and I went through a lot to be here. When I first moved in here, my English was very limited. I had to learn a lot. I was receiving a lot of help and support. I was on food stamps. The reflection right now when I get to work with families who are going through immigration, I had to help them build their resume. I took them to the workforce and we worked together on the resume. Then I helped them apply for a job. Then I went to the first interview. On the second interview, I went with them to the drug testing. And then I went to them to the first and second orientation when they got the job. And get to help them, it gives me that kind of fulfillment.
So Elise's connection to the community and her lived experiences is through her experience with early intervention.
Her ability to approach families and engage with people with disabilities in a way that brings dignity and respect to them is a huge asset for our county as well.
I brought some experience there with working with children and families, and also people who have disabilities. I also was a foster parent at one point in time as well, and so that helped me as well be able to connect with families. I don't particularly have goals for families. I like to support them with whatever goals they have for themselves. So usually when I meet with them, we sit down and talk about, what do you want to work on? What's important to you? So usually I leave it pretty family focused, whatever they think is best for themselves.
So that is it for the video. So we'd be happy to answer questions. I don't know if you caught Rod there, like the extent that he went to help support. I helped him fill out create a resume. I helped them apply for the job. I went to the first and second interview. I went to his first day of work. I went to the UA location so he get to use it. Like it is walking the path with these folks, not just pointing them in the path, which is what makes this program and the what we call warm line. It's more than a warm line, because a warm line implies it's a call and there's a voice on the other end. It's a warm walk more than a warm line. It might be how I describe it, but that is what makes this group pretty special. So I'll open up to questions.
Before we jump into questions, just one piece to add. So we wanted to bring this back before you, first and foremost, to recognize the work of this team. This work really is cutting edge, and I think you'll see it in the research that we'll bring back to you when that's finalized. But we also wanted to highlight this. The grant ends at the end of September, and so the funding does end. And so we have included this in our budget submittal with a request. We would love to be able to sustain this team. We were hoping that the state would have figured out a way to have more strategic vision and funding to put towards prevention. We're not there yet. We are pushing the state in that direction. But you will see this in our budget information as well. So happy to answer any questions about the research, the programmatic pieces, anything that you would like for us to provide more information on.
Thank you, colleagues. Yes, Commissioner Shaddock McNally.
First, thank you all. This is really exciting and tremendous. And so the couple of questions, I have three questions. First question is, there has to be a cost savings in the long run for this, because you're getting folks to the right intervention at the right time and saving maybe a lot of staff time, and also helping, in the long run, I think there's this cost saving. My first question, is there any way the study was capturing how that would work? So for instance, like this morning, we were talking about mitigation. There's been studies, we know $1 spent on mitigation, wildfire mitigation, saves $13 in suppression and recovery. That's tremendous. Is there any way this is going to show in the long run when we go out, maybe advocate or say, hey, geez, long run funding, this would be much better to again, this is upstream kind of work that is common sense to me, but I'm just asking the question so we have numbers or something.
Yeah, we're working, so it's not part of the assessment or the research that CSU is doing, but we are looking at what the cost savings intervention of prevention in general is. So we have some of those numbers that we would be able to share at the end. But there also is a cost per assessment and cost per case that is calculated at the state level, like many moons ago around a workload study. And so with the trajectory, and really it's going to be much more important based on the systemic review that they're doing from other counties. It's that difference that will help us to be able to actually present what we estimate to be the cost savings, because the trend line is that family's trend line, but actually a true difference of involvement in child welfare will help us be able to put an estimate on a cost, but it's not going to be necessarily research to the point of publishable in that.
So, thank you. And of course, talking about cost savings, but really this is about taking care of our families and these youth and our communities, right? That's the priority. But we know how this is, preach to the choir. This costs money, it takes time, and it takes dedicated staff. So I'm assuming that as you are able to do this and able to help, maybe this also helps staff because it helps them get them in the right lane to help them, that takes a little bit of the stress maybe off, or lightens the load a little bit because they are maybe getting them into the right pathway. So it probably takes a little bit of the time away and maybe the frustration for both sides. Is that what is showing? Can you even capture that?
We can do some thinking on how to best quantify that. I would say the challenge is that as our population grows, our referral numbers go up. So we can't quantify we've had a reduction in referrals because of this program, because we have more referrals coming, the population is growing. And so that's the hard part, and we're hearing that from other counties as well. It's hard. The prevention work gets lost a little bit because of the population the growth that happens. So you can't see the direct tie. Plus, this was an IRB study, so there's a lot of limitations on how much true individual tracking we could do for each individual, right? So we want to keep them whole. I would also say that this program is more than just reaching the families and getting them the right path and not entering child welfare, which is a traumatizing event by itself, irrelevant to what happened to that point. It's the getting upstream that's amazing, but it's also that this group of cultural sensitivity, this cultural awareness that this group brings to the table, they are embedded in child welfare. So they are part of, like, our child welfare goes to these folks and say, hey, how do I engage this family that is coming from this lens, because I don't have that lived experience. And so it's not just intervening and impacting change there, it's impacting change within the staff that is also helping us to serve even when we do have to become involved.
And that's probably hard to measure. So my last question, and I apologize, colleagues, but just my head's kind of spinning with all this stuff. And that's really important. You can't really measure that. I think that'd be hard. But in a lot of the meetings that we have, this is a tremendous study, and you get a chance to do lots of studies. And hopefully, I think a lot of those probably don't just go on the shelf. You guys are embedding them with things. And I remember a presentation where, they had, it was online, and I think it was a couple of years ago, where you were tracking where all the people were going. If they're referring from here, they go to here, and you were tracking all of that. Do we still,
We have a community map, which we thought would be really hard to show here for the community audience, because it is, but it shows like the volume of referrals that are going to different agencies into the program, and really what agents, like, we're using those agencies. We're actually working on developing a future prevention plan for the community with a bunch of partners, and we invited partners to that table based on that map of those agencies that were touching families most.
So I'm still thinking about that. I just love that. I'm glad to hear that's there. But is there any way that we can take some of this stuff and prevention kind of start, that's a lot for you, but I'm saying, just take some lessons learned and help. I'm just curious. That's an offline question, but just thinking, I'm glad to hear that's still going. And I think there's just some opportunities to leverage all that you guys are, tremendous work you guys are doing to, kind of be innovative, and I just think this is amazing. Thank you all for this great presentation.
Thank you. Commissioner Stevens.
Yeah, thank you. I agree. I think this is a great program, and I think the work you've done is remarkable. Preventing child abuse is something I think to a person in this county, I would say that people want that to happen. So, given the grant was $2.75 million over 5 years, that's about $550,000 a year. Is that what you anticipate to make this, the dollar amount to keep it going? Okay.
Yes.
Is it scalable at all in any kind of meaningful way if we did, we're not in budget talks right now, but are there ways to do some of this work if we couldn't find that much money? And knowing that, I think it's important, and we, as much as possible, we would push the state to say, this is really a valuable way to do, this is the best practice. This is the best way to do things, is to prevent it from the beginning, and then.
And so Thad and Deb and Katie have been pushing the state, have been pushing nationally, presenting this in really any venue that they will have us. And there are discussions coming out of last year's interim committee, the legislative interim committee. There are a lot of discussions happening at the state level that this should be the warm line that we're looking at statewide. Now, the funding and being able to scale it is, a lot more conversations still need to happen. But this is really being looked at by other counties trying to move in this direction on their own, but then also trying to push the state. Thad, and we're going to get to this in the financial update, but Thad's been working on the funding committee that's part of the Child Welfare Allocation Committee that's looking at what is the long-term funding model for child welfare, and how do we include prevention in that. So the Child Welfare Allocation Committee is supposed to have that work finalized by the spring to then drive allocations starting in 25-26. So there is work happening, and we're moving in that direction. I think, the picture of the state's budget is what will determine how much of that comes to fruition, but it is moving in the right direction, just slower than we certainly would want.
Yeah, part of our challenge, we honestly thought we had some, and that's a lesson learned for me, to don't bank on anything that you think the state's going to do. That prevention was supposed to be in this year's funding model based on PCG work that they had done and recommendations they had made at the state. So we felt like we had a reasonable path. And then lots of things happen, including the high acuity youth and everything that's happening in the child welfare community. So that kind of started pulling away attention to something that is very important. Secondly, I'm also now a fellow with Foster America and working through other funding sources that could support this. So as a reminder, Foster America, we got a fellow through Foster America that helped us design this program with the community. And so they asked me to be a part of this to continue to help sustainability. Foster America is also very interested in supporting us through media and other things if that's something that we needed to go down. But we're kind of holding it until some of these other things are happening. The other piece is we do believe there's an opportunity for us to maybe become a Medicaid provider as a county agency and get some Medicaid funding to support their work, because it is care coordination, it is accessing, like we just got recent data that the folks that are involved with this group are 80% are on SNAP, 80% are on Medicaid, but the TANF number is a little low. So I think there's some opportunities to actually continue to grow the supports families get. And if and one of those factors is Medicaid might fund programs that are connecting to other Medicaid agencies and systems. And so we believe, and California has actually already done some of this work to figure out how to do that. So we're stepping into how do we figure out how to do that in a future state so we can create longer sustainability, and it's not a burden on the system for, a burden is the wrong word, but a drain financially on the system, because we can maximize all those funding sources in the future.
Thank you. I appreciate you thinking about that creatively, because it's good for us to think, how can we make this happen, and at what level can we make this happen? And certainly with the concrete resources, those are things that we are working on, housing and different kinds of, eviction protection. Those are, that's a piece of this. That's a big piece of this that we need to kind of keep, because, man, it is hard when you can't figure out how to pay your rent to keep your family together and to not be stressed out about that. And so, thank you, and keep us posted of how we can help.
I have a few questions. First of all, I think it would be helpful to know more about the protective factor survey. What is the methodology behind that? How did you all decide to use that tool? Just like to understand a little bit more about that, as brief as you can be.
It is the protective factor survey, and again, we're using the second edition. There's more than one edition. It comes from it's called Friends, and I'm going to have to think of what the acronym stands for. I apologize. It'll come to
Friends?
me in a minute.
Friends.
Out of Kansas. They created and developed this survey, and its intention was, instead of looking at, like the ACEs looks at what isn't working, protective factors looks at what is working.
Strength-based and.
It's a strength-based approach that is written and driven in a way that it's very easy to understand. It does not take very much time to walk through that with someone and to talk through those questions. It scores from a 0 to 4. So those numbers that you saw, it only goes from 0 to 4, and it looking 0 is that's not an area that is of strength, and 4 is an area that is a strength for you. It is reliable, it is validated, and it has been used across the country. We chose this particular survey because of those reasons. It's reliable, it's validated, and it's easy to use, and it does not take a lot of burden to administer it and to score it.
Does it come in multiple languages?
We create it in multiple languages because we have families that we serve. So our navigators translated it to make it effective in multiple languages.
Thank you.
And the
Thank you.
other thing I might highlight is that there's also a lot of evidence that it's also very directly connected to the, social determinants of health. And so there's lots of, it is a like, for lack of a way to define it, it's a well-being tool for families, and we in child welfare are supposed to pay attention to all those things: well-being, safety, right, and permanency. But well-being is the hardest one to measure, and it is a well-being tool that our other community partners, like Matthew's House, also uses protective factor service. House Enabling Services is using it as part of this work. So it is not just this program because of the value that it provides.
Great. Thank you both for answering my questions more than adequately. I have a few more. Regarding the matter of the funding ending at the end of September, and I appreciate that you already are thinking about what are some of the options for continuing the program's sustainability. Should we not be able to continue the program, I would like to put that scenario out there. What are you planning to do? How will you support those families if our navigators are not able to continue with them? We'll do our best to try to figure out the budgetary matters, but I think we've learned recently that we need to be prepared for a worst-case scenario.
I think that's a great question. Thanks, Commissioner.
Thank you, sir.
I think we've done a couple of things. We have a great director that's helping to support the program. So in essence, even though the funding is ending in September, at the end of September, we are absorbing this team into the child welfare budget for the next 3 months to allow them to work through with all the families that they're already serving and not have to stop service prematurely. And so that is part of it. So even though, because obviously end of September is right around the corner, they know that the program is in existence until the end of the calendar year. We are also leveraging that they may be able to provide other services within child welfare for a brief period of time. Our parenting time program, for example, they are a similar classification, so we could use them to provide some parenting time and not outsource so much that we have to outsource to the community to do that. So what we're trying to do is create a little length of a pathway so they don't have to make a decision personally about their life. I need to go find a job now. We wanted to give them a little bit of time so we could have an awareness of where we were from the budget proposal, where we were from any other information coming from the state, and kind of the state spending in child welfare. So we tried to give them, so we were trying to hold so they didn't feel like they had to go find a job right now, and they had a little bit more time to hold on to until they know that they actually don't have an opportunity to maintain employment.
And the other thing I would just mention, Commissioner Kafalis, is that I have been in conversations with our partner agencies that serve families in similar ways and have talked to them about, if we are unable to sustain, how we help transfer some of these families within the other agencies in our community that are serving in very similar ways.
Thank you. I think we've gone over our 9 minutes, but I don't want to, we oftentimes, fast forward when it comes to these folks. I would like to ask a few more questions, if I may. And also to point out that if there is perhaps a proper role for me to advocate on behalf of more prevention funds, I don't know if CDHS, Colorado Department of Human Services, has included that in their budget requests for the state budget for November. Perhaps you folks know, but if there is a proper role for me to speak with the Director of Human Services, since I have that person's ear, please keep that in mind. I'll move along with my questions. Is that okay, colleagues? Just a couple more. I appreciate the video and that the program is family-driven. I wonder if anyone could just dig a little bit deeper. I mean, in my experience, which is limited, and knowing that I don't really officially have a social work, human services background, but I think you have referred to me as an honorary rather than, but sometimes, well, actually, and I have done direct human services with Project Self-Sufficiency and with the job, JTPA and all that. I'm wondering, having navigators with lived experience is a big deal. That makes a $1 million difference. But can you say anything more about how they work with families to get them to actually, sometimes you have to prompt folks to get them to speak up and say, I think I need to do this, I need to do that. How does that trust building happen? Does it take a long period of time? And how do they get people to open up enough where they feel safe, where they can share, I want to do this, I want to do that, or my kids are struggling or whatever? Do you follow what I'm asking
I
there?
totally follow what you're asking, because that was one of our biggest goals when
Is
we
that
started
right?
this, especially being housed in child welfare. My worry was families would see Larimer County or child welfare and assume we were automatically attached to the child protection system. So we had to work upstream a lot, and our focus was going out to the community and doing what we called onboarding, and that's a very broad term, to say, this is who we are, this is what our services are, this is what the navigators can do, this is who they are. So it not only became about a trust within the families, it became a trust with our community partners. And we don't make any cold calls. So a family must be told that they're being referred to our project, and/or they may make a self-referral if they choose. So that partner agency is sitting with them saying, there's this program and here's what I know about them. And so far, we're feeling really confident about their ability to support and help you. So I think the answer to your question, Commissioner Kovals, comes from two directions, from our partners and the agencies in the community, as well as for families. And when the navigators are with them, because they're not telling them, they ask, what do you need? What can I support you with? It opens a door that they haven't often been asked.
Thank you. And a follow-up question, and just a yes or no answer. Do the navigators receive some level of training? Because I'm assuming they don't all have, social work degrees and that sort of thing.
That's correct.
Yes or no, they do receive training?
Correct.
How to ask the questions and all of that
Correct.
kind of stuff?
Motivational interviewing.
Okay.
My work as
Okay.
a child protection.
Moving right along, because I don't want to get in trouble with that. The slide that talks about high intensity, low intensity, what is SN/CM in the little boxes at the bottom, that one? SN/CM, what is that?
Service navigation case management.
Oh, of course, okay. I think my last question, yes. So regarding the PFS scores and the 5 areas and the one, family functioning and resilience, I believe it was this morning, there was a story on NPR, some kind of study that was done. I caught snippets of it, but it talks about how parents in general are feeling a lot of isolation and a lot of stress more than, those who are not parents. And as you might imagine, single parents are, more of that. So I'm wondering, is that something you have been looking at, sensitive to, the stress that might be associated with being a parent, perhaps, the isolation? I believe that's my last question.
They are definitely looking at that with families. And what I will say, when you look at the concrete supports, because those scores are so low, what we know is that if basic needs aren't met, it's very, very hard to address my loneliness, my isolation, my parenting skills, my parenting abilities, my confidence in myself as a parent. So what we have found through this project is that our first and foremost, most often, is addressing their concrete support needs. And then as they feel more secure and safe, and or feel like there's a path for them to address those needs, they are then able to look at family functioning and resilience and their social support network to increase the protective factors over time.
Great, thank you. I think in the interest of time, I will hold back, let go of any additional comments or questions, other than I think this is great work, and I hope we can figure out a way to have it continue. But it's great that you've absorbed these folks into your system as best as you can.
Thank you, and we will, as soon as the research is completed and ready, we'll bring that back to you and share
When,
it.
by the end of the year?
Yeah. CSU has 120 days from the end, so it'll probably be end of January by the time we get an actual formal report from CSU.
And I'd be curious to know if the CDHS, Department of Human Services budget proposal is including additional funds than in the past on prevention services.
We would love to know as well.
Let's get.
They're not able to share anything with us up until November 1st, so.
Then maybe I should have a conversation with the director. No, she won't share it either. Yes, thank you. Let's move on.
Thank you.
Thank you for indulging
Thank
me,
you for your
colleagues.
time.
I'm sorry.
Thank you, Deb and Katie. Okay, so switching gears quite a bit. Every August, we provide an update on funding. So as a reminder, most of our funding streams operate on the state fiscal year. So that just ended June 30th. And then we've started a new state fiscal year. So this report looks a little bit different. We usually give you a 2 or 3 page that has a lot of red and green numbers that just represents the closeout of the prior year. So we've changed the format of this report. So open to any feedback you might have. We've also added the specific numbers for the upcoming year so that we're reporting on both and it's easier to see sort of the changes from one year to the next. So just going alphabetical order, so we'll start with Adult Protective Services. Lori will jump in. So the top portion there is the closeout of the last state fiscal year. And the bottom table there is the funding for the state fiscal year we've just started. A couple of pieces I would point out. One, I would say this is the program I am most concerned about financially. We continue to be overspent. The state as a whole continues to be overspent, and there really is no strategic plan happening. So this is one of the top budget priorities for the Colorado Human Services Directors Association in our work with CCI and CCAT as the commissioners associations. And our Human Services Association provides a letter to both state departments, all 3 state departments, with those priorities. So you'll see it's really being driven by the lack of increase in the administrative line. There is very little flexibility that we have. The rules around this program are quite prescriptive on the number of staff to supervisors. It doesn't go so far as to say the number of cases that we should have, but our caseloads are growing quite a bit. And the Elder Justice COVID line that's there on the bottom, those funds have ended with this last state fiscal year. So those funds were actually used to try to reduce our overspending in the administrative line. And we won't have that opportunity moving forward. So what the state does is in the client services line, if that's underspent, then they move the funding to cover the administrative overspending. But at the end of the day, there still isn't enough to cover that overspending. So we were 146% spent at the end of the state fiscal year. And our allocation goes up slightly for this current year, but still not enough to cover our expenditures that we had from the last state fiscal year. So this really is the state level advocacy because there isn't flexibility that we have to reduce expenditures and really trying to make sure that our local delegates understand as they're looking at the budgets and legislation that might come impacting this program area. Anything?
How do we cover the additional, where does the additional money come from that, to make up that deficit? Perhaps we could have Lori answer that.
Lori Metz, Division Manager, Aging and Adult Services. It comes from our surplus here locally in Human Services or any county admin dollars that might be available to us. The only thing I was going to mention is when we get to more of the department activity piece, you'll just see that, yes, when we were seeing trending up last quarter of the number of cases for APS and referrals, that continues. It was not just a fluke. So the work continues.
So it's a conversation we've been having for over a year, especially with the Office on Aging and things. And it's my understanding, and maybe I just need to ask this question here now, when we have Office on Aging, we're getting federal funding, it's still costing county funding to run that office with staff and things, right? It's not a complete, the funding for that comes through the federal government isn't completely covering all of those costs.
So there's a little bit of there's different scenario for APS from the Office on Aging. So in Adult Protective Services, the county is required to contribute 20% of the total funding. But as Lori said, so we are in the allocation column, and this applies really to all of the funding streams we'll talk through. In that allocation column, 20% of that APS admin is what the county is contributing. But in actuality, we contributed that 20% plus the 46% that we were overspent.
Okay.
Because that, anytime we overspend, the county has to cover that 100%. So it is a more significant county contribution in Adult Protective Services than it is in the Office on Aging, just because of the funding methodology is different. But yes, the county contributes to both, and we are seeing across the board in these two program areas, but in every single one of them, significantly less coverage of our overspending through the state closeout process. So we are, across all of the program areas, having to make some really significant reduction in expenditures, because our strategy of overspending, because we would be able to then recoup counties that are underspending, is drying up and is no longer the case.
So, do you know if other counties are experiencing the same?
Yes.
Okay, so this is not, and I know we advocated quite strongly for this last budget. And we know this next budget is looking even more tighter. Is there any glimmer of hope? Because I know some of the advocates, the state, the center, that Center for Aging or whatever, they're pretty loud and had a lot of activity, but that didn't seem to really get an understanding, because there wasn't really that much of an increase in the budget this year. So I'm just curious, are they aware? Some of them aware of because it seems like we're getting more and more, I hate to use the word dire, but this is starting to get very impacting people's quality of life, and
Yes.
in a very, very negative way for folks who are older adults who deserve, a lot of care and protection. So I'm just curious, this is really sounding alarms around the whole state, or just that we're kind of the first to kind of raise the alarms?
I would say both and. So it is a concern across the state. What we have heard is that the state departments were asked to submit budget neutral budgets.
Yeah.
So I don't anticipate we're going to see a lot of relief, at least in what's submitted in November. Now, what plays out through the legislative process is completely different. But I say both and because we have also seen our costs increase quicker and at a higher rate than other counties. So I would say our overspending in the costs that it is requiring to provide services in the community is increasing more in northern Colorado than it is in other areas of the state. But it is a concern across the state.
And I think that's what the state demographer has been telling us for years in
Yes.
the presentation. So, okay, I appreciate that. Thank you.
Please continue.
So switching then to child welfare, so there are multiple line items that roll up in the child welfare budget that cover the services that we provide to families, largely through vendor contracts, community partnerships, and then also the staffing and the administrative costs. So this is another area where for the first time in 8 years, the state as a whole was overspent in child welfare. And so we're seeing the same challenge and concerns across multiple counties, certainly driven by the big 10, 11 counties. And you can see it in broken out. It is driven by out-of-home costs, as rates to foster parents increase. That drives part of it. The cost for staffing drives part of it, and the cost to administer services drives part of it. So there is a lot of complexity in what's driving the overspending. And at the end of the year, we were in total 9% overspent. And then you can see the table there on the bottom. We are receiving a slight increase in the child welfare block funding, the child welfare line there. I say slight for two reasons. One, it still doesn't cover what we're already spending in the last state fiscal year, and the increase really is going to go entirely to the kinship changes that came about from Senate Bill 008 from last year, where we are going to increase the rates that non-certified kinship caregivers will receive in the financial assistance to help care for those kids. That will come out of that line item, and we absolutely need to and want to provide that support, and the funding mechanism that came through the legislative process is not sufficient or sustainable. So a lot of conversations happening as that change goes into place on September 1st. Then moving to Child Care Assistance Program, this is another program. We've had the freeze in place since February 1st. And this program is trying to adjust to very significant loss of funding in COVID ARPA funds. So it's broken out into different line items. We received 1.7 million last year alone in COVID funding that is going away, will not be available. And then through the legislative process, what the COVID funding has been funding as a short-term strategy, the legislature and the state wanted to sustain those programmatic changes. And there is still a shortage of funding to really be able to do that long term. But that is what's driving a very slight increase. So last year we had just over 8.2 million for the Child Care Assistance Program, going up to just over 8.3 million. The challenge is we anticipate spending as much as 9.7 million this year because we have no ability to reduce expenditures. We're not able to remove children from the program. We wouldn't want to, certainly, but that's a federal limitation. So we'll be coming back for additional conversation about this one and trying to figure out what we do with this one.
What's it going to, if I may, what's it going to take to unfreeze the CCAP? We have a waiting list. I think a subsequent slide shows some of those numbers. So what's it going to take to start serving more kids?
So it will take, at a bare minimum, an additional 1.6 million today to be able to move from a freeze to a wait list. So that wouldn't be to serve everyone that needs it, for sure. That would just be to come within budget today. The other piece I would add, and I can send you a much more extensive document there are changes happening in rule at the federal level that are also impacting some of the programmatic changes happening at the state level. The state anticipates that just coming into compliance with the federal changes that are required to be implemented fully by 2026 is going to cost the state $52 million. Part of those changes actually go into place October 1st of this year. So they've come up with a phased-in approach, and they're trying to get waivers from the federal partners to say we can't implement this until 2026 in totality. It's hard to reconcile $52 million in changes with a budget neutral, right? I don't know how that's going to, how those two things are going to fit. And I do think that there will need to be some additional steps to try to figure out that process with the State Department. Our share of that $52 million is generally 5%, is what our program serves of the total. And it is making some really significant changes that will provide better services to families and better services to providers, but it could potentially cut the number of families we're serving by 50% if there isn't more funding. So how we navigate that in the next couple of years, we will need to have a lot more conversations. Okay. Switching to Colorado Works, or temporary assistance for needy families. So this is the program that provides case management to individuals that are receiving Colorado Works and trying to help them increase employment or secure employment to get out of poverty. And so this, there's a blend of what this allocation pays for. The biggest chunk of what this allocation pays for is the cash assistance that's provided to those households. That's part of this, and then the staffing for the case managers, and then some flexible funding, if you will, where the budget allows to help with transportation, help with, sometimes it's securing a training program if someone wants to get their CDL, helping to upskill the individual that's trying to increase their income. This program so we were just slightly over budget last year. The challenge with this program is we're actually taking a 5% reduction at the same time that the amount that households will receive in their cash payments is going up quite significantly, and we have to absorb that into our allocation. The reason we have to absorb that into our allocation is because there was a plan, a 3-year plan that the state had sort of cobbled together. A third of it would be paid for with ARPA, a third of it would be paid for with state reserves, and a third the counties would have to pay. With the loss of ARPA, that now shifts, and we have to cover 50% of that. So it's taking the 5% reduction in our allocation and then also absorbing the increase in the basic cash assistance. That's what that cash payment is called. And so it is very likely we won't have any flexible funding for the additional needs that these clients may need. So it's trying to identify other partners, identify other resources that we might be able to provide from different programs. But this one is taking quite a bit of a reduction because of the loss of allocation and also the absorption.
Yes, of course, Commissioner.
This is an entitlement program, or is this, or a program that?
It is.
It is. So
And the basic cash assistance is the entitlement piece of it. And that's, so we have to cover that, and then the remaining allocation covers the administrative costs for the case managers that help those individuals. Okay. Switching to the community services block, I apologize, I don't have very good news today.
Yeah, I'm kind of glad that we started out with some
Yes.
good news. I'm hoping you'll
Yes.
end with some good news.
We will try.
Although I have a concluding question that kind of
Sure.
that maybe I should wait. Maybe I shouldn't wait till the end because it might be a real downer, but
So Community Services Block Grant, this is one of the, so this actually operates on a calendar year. So we are actually right on track with where we expect to be spent by the end of June. That's why this one looks different in showing that we're only 40% spent. So this is the program that helps when we're experiencing the challenges with Colorado Works. This program is unique to Larimer County. Not many human services departments have this in other counties. And it is entirely dedicated to helping people get out of poverty. So it's quite flexible, and also it has to be focused on helping households get out of poverty. So we're tapping into this program quite a bit to help those Colorado Works households when we need to. As that budget constricts, we are able to utilize the resources here, knowing that even with a $512,000 budget each year, we spend that before the year is over.
isn't there a formula that determines how much CSBG funding
It
different
is-
jurisdictions receive?
Yes, so it's based on total population demographics, poverty demographics.
Cost of living demographic?
I don't believe cost of living is one of them. It's really mostly population driven. And then how much of that population lives in your municipalities versus unincorporated. So not a lot of counties have this program included at their human services level, I would say. County administration, so there is some good news here. I will highlight this here. And yet still challenges to come. But so county administration, so this is the allocation that helps cover the cost that the county has to administer the public benefits programs and is the group of staff for the programs that are using the Colorado Benefit Management System, CBMS. So this one actually is a better, I'll show you this graph and then we can go back to the numbers. So I'm showing you this because you can see there's a really significant increase from 2018 to 2024 into 25. So that's state fiscal year 2025. That's why it's labeled that way. So that's the current fiscal year that we're in. Our allocation has increased from 6 million to 10.7 million. That's a really significant increase over that period of time. And we certainly have needed it. And going back to this one, you can see that we're already spending 10.7 in last year's spending. And that includes the some additional COVID public health emergency funding that we receive from healthcare policy and financing that will also run out this upcoming year. So we are so we're trying to figure out the best way to explain this. So we are needing to reduce or at least keep our expenditures where they are. Because when we overspend this program, we cover the overspending entirely in county funds. There is not a sort of beg, borrow, and steal from other places. It comes from the county. So that's one piece. And there is a lot of work happening from Senate Bill 2235 that had a workload study and a funding model that is now coming to fruition. So what that workload study showed is that this program at the state level is underfunded by $30 million just to handle the workload we have today. And then they developed a model that they can use over time to try to gauge that gap as the work changes into the future. So we have we're doing a lot of work to try to advocate for that funding, try to figure out where that funding comes from, while these programs are also experiencing significant transition because they were directly impacted from the pandemic. So this is our Medicaid processing, this is SNAP, those programs where we've seen a really significant increase in workload volume. So a a lot of state level advocacy, a lot of work directly with Executive Director Michelle Barnes and Kim Bimsteffer, and trying to figure out where this funding comes from. Director Bimsteffer, I have heard her say it now twice in very public meetings, that her top priority is to figure out how to fund this and how to shrink that gap as best as they can. Most of the underfunding is in the Medicaid programming. There's underfunding in SNAP and the other programs, but the most significant portion of it is in Medicaid. And so there's a lot of partnership happening to try to figure out the county funding and resources. And then parallel to that, a lot of work happening on the Colorado Benefit Management System, CBMS. We had 2 very significant outages again last week, where there were upwards of 100,000 households that were impacted because the system went down for an entire workday, and then we can't help members of our community. So my understanding is that the governor's office, Lieutenant Governor Primavera, is convening a meeting in the next couple of weeks where they plan to walk through what is that long-term vision for the CBMS system and be able to share additional information as to why scrapping the entire system and starting over isn't feasible, what the cost of that would be, and why we're trying to enhance modules within the system, because scrapping it and starting over just isn't. It would cost, I've heard estimates of over $100 million to rebuild a new system. So there is a meeting coming up in the next month. We don't have a date yet, but the governor's office and his team have become involved and convening different collaborative meetings to try to work through what is the issue and what is their plan to address it.
We're not talking about trails right now.
I know we're not. But trails has been, I feel like the movement to fix trails has been successful. Is there any idea that OIT could jump in after they're done with trails? Because, we're hearing trails might be done by the end of next year. I don't know. I'm just saying. And
So,
also, yes, I can serve on the next committee.
I have heard that the movement on trails has been very successful in a large part because of your leadership. So we want to recognize that first and foremost. It's very interesting to me how OIT identifies and deploys resources. And then there are also contract teams in healthcare policy and finance and the State Department of Human Services. So we don't yet know what the plan is for that and where the resources are going to come from. But Commissioner Scott James from Weld County sits in your similar seat that you have over trails. He's on the Executive Steering Committee for CBMS and is asking that question several times a week. So we should have, I think that's part of what they're hoping to get from this upcoming meeting. What is that plan and where the resources are going to come from, either financially to identify more contract resources or where they will come from within existing capacity.
I would be interested in knowing when the date of that meeting, if you think it would be helpful for me to participate and listen.
Okay.
Listen in, so please let me know. A question I have is, what is the status of presenting to the State Board of Human Services regarding county perspective on CBMS? I didn't hear back, and I wondered if that was still something we were trying to do.
So I will check with Katie First from Colorado Counties Inc., CCI, was working on convening that. And so I can check in with her this week to see. I think it's slowed a bit as the governor's office has become involved in some of the conversations, but I can get a status and send that to you. Okay. Employment First. So this program operates on a federal fiscal year. So different timeframes for this one. And also, I would say this and the Office on Aging are the two most complicated funding models we have. This one has 9 different sub-items that roll up with each of the 9 line items all have different county match requirements. This one's very complicated. But this program provides the case management for food assistance recipients. So it really is the sister program to Colorado Works. And Vanessa Fuel, who oversees our Benefits and Community Support Division, she's not here today because she's actually presenting at a national conference, or presented yesterday, on some of this work. She has been fantastic in trying to pull more funding from a turnip, if you will. We have expanded and now have what are called third-party partnerships, where some of our community partners have contracts for Employment First with the State Department that allows them to pull in more funding for the community. So we're constantly trying to push the envelope within this very complicated funding, and also look at how we can serve households, as a lot of them are often enrolled in Colorado Works and food assistance at the same time. So looking at how we can serve those households and meet their needs, trying to move between the programs. Office on Aging. So our allocation for state fiscal year 23-24 is there on the left, and then the expenditures there on the right. And this is another program that is losing a significant infusion of ARPA funding, COVID-related funding that was passed directly to the State Unit on Aging at the State Department of Human Services, and also then an additional reduction in our allocation. So our total funding for last year was just over 4.3 million, and we are having to reduce down by 26% to an allocation of 3.2 million. So we have modified contracts with community partners. We've had to reduce those contracts as this directly impacts the services to older adults and their families, their caregivers. We talked quite a bit with the Adult Protective Services. Okay. And the last one, so A&D, which is...
Here, one moment.
Sure.
Please.
So, this is also, we've been having conversations about the Farm Bill and talking with our federal partners. So that hasn't had any, that bill's not looking to come through till next year if at all. It's stuck. So this is not, there's no light on the horizon for changes for this, correct?
Correct.
Okay.
What we're hearing at the federal level is that there won't be much movement in the Farm Bill or Older Americans Act or other congressional items until after the election.
Yeah, okay.
And into the new year.
Thank you. Just wanted to ask. I've been talking a lot about it, and I know people are aware, but it's unfortunate. So, so when we talk about some of these partners, I'm thinking like Meals on Wheels and some of these other things. There's a lot of, it's not just a meal; it's so much more. And so, have we been telling them that, our hands are tied, and this is, I'm sure I know you are, but I just wanted to kind of publicly ask about that, because it's not like they're not been in the dark. They can see the writing on the wall as much as we are. Would that be true?
Yeah, absolutely. Lori Metz again with Aging and Adult Services. Through the competitive process when they apply for our funding, what we're also seeing is that the increase in cost for them to do business. So a good example is transportation, where, maybe it used to be $5 for a ride and now it's $9. So it's kind of two things happening at once, the reduction in our allocation and the increased cost for them to do business are happening at the same time. So we are communicating with them. When we do get final numbers, typically in the spring from the State Unit on Aging on how much we're going to be able to carry over into the next fiscal year, we do work with our contracts team through the operations division to make adjustments to some of those contracts to maybe make folks a little more whole to what they'd asked for initially, but that just all depends on how much money there is remaining. And sometimes we can't carry anything over. It depends year to year on the State Unit on Aging's decision on that.
Okay, there's another point to talk about. Okay, another day offline. So, okay, I appreciate your time. I just, it just seems like a lot of conditions are coming together at the wrong time and the wrong place, and that's another red alert kind of thing. Okay, thank you.
Oh, yes.
I just have a suggestion, since we are running short on time, because I think we're only supposed to go to 3, right?
I believe the
Oh, we
thing
have till
says
3:30?
3:30.
Oh, okay, never mind then. Okay.
How about if I cover this one and then we can come back to your,
No, I was just going to say, well, we should find another day to look at this, but I thought we were only on till 3, so we have, all right, we're good.
Yeah, but let's not get too carried away. 3:30 can come upon us rather quickly.
it will.
So let's continue to be as efficient. Maybe we'll want to get through some of these and ask some questions before we move on to the activity reports.
So this is the last allocation to cover for this report. So this A&D is Aid to the Needy and Disabled Navigator Program. We've highlighted this a couple of times before you all, also when the state board has visited, because we see tremendous success in this program. And unfortunately, the program has come to a close and has ended because of legislation in the spring. If you'll recall, when we did our legislative update, and I'll have to look and see what the bill number was, but there was legislation that was passed to create the Colorado Disability Opportunity Office because the new colored license plates is generating so much more revenue than they anticipated. So they've created this new office, and then any programs in other state departments that were serving individuals with disabilities or their families was then absorbed and is moving to this new office. So this program is ending has ended at the Colorado Department of Human Services. And what we've been told is we're waiting for grant opportunities to open up so that we can apply for grants to try to sustain this program. We have sustained this. We have one senior case manager that does fantastic work with this population. We have sustained her. Her work is so impactful that she is actually, when we help individuals navigate from this state-funded program to federal Social Security benefits, we then are able to recoup some of what the state paid into the program. She is almost covering the cost of the program because her work is so tremendous. She is getting people to the federal Social Security benefits 6-9 months sooner than they have in the past. And they're transitioning to that program and have more sustainable benefits through that program. So we have sustained her, and just recently actually moved her into the Office on Aging team so that she's working with that group and increasing the collaboration as they're serving often the same individuals across different programs.
Yes.
It's interesting. I ran in a different universe, but still county universe. The wonderfully energetic CSU student who's doing the study for Office on Aging and had some great information. I mean, of course, a lot of that stuff I hear all the time going out in the county, but I was just curious with her work if there's just kind of like the other study you talked about, there's ways to see if we can reach out to folks or provide, any savings or innovation or things that way. And I know she hasn't kind of quite finalized all that work, but I'm just curious what kind of outcomes do we hope we can use to help us with the funding challenges here too? Is that a okay question to ask? Or is that more just to how to increase the outreach? But I'm hoping there's maybe some ideas for innovation, so.
Sure. Lori Metz again. Actually, our internal business analyst and that team who does diligent work within our department to look at programs and put together, packages so that we can apply for funding or, to look at efficiencies within it, has done an amazing job on the A&D Navigator work. And when we met with you all and presented on the program before, there were findings that we shared with you all. But I just looked actually, and she's had 23 approvals this calendar year for Social Security, which is pretty unbelievable at this point. So we're going to work closely with our internal team who had done that analysis of the program once we get the application for for funding to see what it could be. We were told October, then we were told maybe as early as August. There's a few days left in August, so I guess there's still hope that we might still see it. So we've also been able to leverage a bit of ARPA funding that was left in the Office on Aging to help sustain her program as well, because we also do offer like Walmart gift cards, gas gift cards, things like that to those clients. So yeah, we're looking at a lot of angles. And to Thad's point, this is another program that we're going to be looking at with maybe some Medicaid reimbursement pieces.
And then we are bringing the totality of the assessment and the research that CSU has been doing.
Yeah.
It's on our agenda for November.
So when I first started serving, before I became a commissioner, serving on the Office on Aging Advisory Council, we had just received the No Wrong Door grant. And I'm assuming that's kind of been embedded, and this is also kind of a part of that, right? That it's, you don't just say, hey, well, here, just call this person. This is also kind of part of that. I mean, I just see there's so many lessons learned, and that it's getting more upstream to help folks get to resources quicker. So I'm just curious about all of that.
Sure. So to answer about the No Wrong Door portion, when that grant ended, which I believe was in 2018, we decided to keep the work going within the Aging and Disability Resource Center through the Office on Aging. So that philosophy is still there with the No Wrong Door piece. And then I think at the state level, that's also what you're seeing with the work to the Case Management Agency piece for the Medicaid waivers for long-term services and supports is that model. So I don't think it's called that anymore per se, but I think the philosophy is still there and is going strong. And that was part of the reasoning of placing Leanne, the senior case manager for this program within the Office on Aging, is that she could feel supported with a larger team and just access those resources. And then that's one less phone call for someone to make to find her.
Exactly. All right. Thank you very much. Appreciate all that.
Any additional questions on the finance report?
Folks from A&D go to SSI, or is it also SSDI? What is it, SSI?
SSI only.
And can you, just for the record, explain to us the difference between supplemental security income and SSDI?
My pleasure. SSI, or Supplemental Social Security Income, is for individuals who have not had enough work quarters to qualify for SSDI, which is Supplemental Social Security Disability Income. So think of individuals who maybe have intellectual or developmental disabilities, chronic or persistent mental health issues that have prevented them from being able to work successfully in the community. So to get SSDI, Supplemental Social Security Disability Insurance, you have to have worked 3 out of the last 4 years, essentially. So 30 out of the last, I think it's 40 work quarters or something of that nature. And that's based on what you've put into the system, where SSI is a flat amount regardless of your, maybe little to no work history.
Thank you so much.
And then when you turn 65, those all turn into SSA, which is the what everyone gets. Well, most everyone gets.
We hope.
Yes, that's another conversation.
I'm glad you did that.
Okay. So we are going to shift gears to the last agenda item. So this is our...
Actually, I would like to offer my downer question.
Yes.
So I in light of, forgive me, but in light of all of the budget uncertainty that is all around us, with special sessions, with possible ballot measures that will likely or will have an impact on the county budget, and recognizing that your funding is varied, there is a portion that comes from mill levy. How are you all, I mean, our budget folks, overall county, are doing the best we can to analyze and prepare. How are you doing that in your human services shop?
Oh, we could spend a whole day on that alone.
Just some
I would say,
assurance.
in a lot of different ways. So I think Commissioner Shattuck McNally mentioned it. Some of the challenges that I think the county as a whole is planning for are already coming to fruition in some of our program areas. So it's balancing a reduction of expenditures, as we just outlined, to come closer to allocations, because there is less money at the state level to cover us when we overspend. So we've been making those reductions in this current calendar year already. while then we also look at what might be coming in the next calendar year and with allocations. So we spend a lot of time going through, we do a budget retreat, but it's a lot of, we meet monthly and go through each of the budgets monthly to see where we're spending, where we project to be at the end of the year, and making adjustments as we need to. Continuing to find efficiencies across programs, and also a lot of difficult conversations within our leadership team to say, what are we mandated to do? And what have we layered on top? Certainly to a benefit for our community, but some of those things we're not able to continue. And so how do we transition without the impact to those that we're serving and our community partners? And then readjusting teams, and adjusting as we need to, just being really adaptable from month to month. Very much like I know Matthew and Josh and other departments are doing within their funding streams.
Thank you. We shall continue.
So this is our department activity report, standing agenda item each time. I'm going to turn it over to Jill. As you'll recall, in our last meeting, we switched the format of the report and now have it available in Tableau. So she's going to give you an update on how this information is now publicly available between meetings. And then each of the division managers are just going to hit a quick high point of what they want to highlight in one of the slides.
Definitely. So I'm Jill Mosh. I'm the Administration, Communication, and Excellence Division Manager. So I'll just talk briefly about this activity report. Last time we came to you guys, well, actually, the past few years, we've just submitted a PowerPoint presentation that's taken many hours prior to this meeting to put together and very manual work. And so prior to the last meeting that we had with the Board of Social Services, we worked very hard to get this into a Tableau dashboard. And so with that, the data team worked to create less manual processes. So there's about 22 what are called dashboards or pages in this report, and about 19 or 20 of those have been totally automated. So that means there's no more manual pieces to go out and grab that data. We can just connect it automatically in the back end of this program and upload the information to this document, to the dashboard. So what we did was we worked with our county IT department to publish this dashboard. None of the data points are publicly available. So if you try to get in there and see, is Jane Doe on this program, you're not going to be able to get to that level of detail. But we did publish this through the Human Services page, so you can see the link up top, but it's off of our main Human Services page underneath quick links. So it will be updated at least quarterly because of the mechanism for how we share the data is based on quarters. So we'll be updating that at least quarterly, but we could probably do it monthly if that was something that we wanted to change to. So that's just a brief overview, and big kudos to that team for the amount of work that they put into creating this dashboard. And we'll be taking some steps to kind of put things together to make better sense of some of the slides as time goes too, so that we're overlaying data that makes sense to overlay on top of each other. So you might see that.
So the nice thing is if you're at the State Board of Human Services and you want to call up some of this data, you can do it on a phone or on your tablet and be able to see it. The most recent information that they have published would be right there, transparent.
Yes, I know, it's great. So, yeah, so I'll cover Vanessa's. Do you want to go back to the dashboard? And I'll tell you, we're going to go to the BCS Food TANF tab.
One moment, please.
Go ahead.
Can I selfishly ask you, I'm sure my colleagues would too, could you send that link to us electronically so I can permanently bookmark it on my phone? Thank you.
Definitely. So it takes a minute to load, but I'm going to cover Vanessa's since she is out of town. So the SNAP caseload continues to climb both in the amount that we're providing to clients. So that's what this dashboard is showing, is the amount of SNAP and TANF benefits that we provide out based on quarters. And the caseload is also climbing at the same rate. So that is actually shown on the next tab, that's BCS caseload. So you'll see that that is also increasing. So you'll see this quarter of 2023, we were at about 17,000, and this quarter of 2024, quarter two, we were at 18,300. So continuing to see increases there.
And it's been a continued increase along this rate dating back to 2019. In 2019, our caseload was about 12,500, and so increasing up to over 18,000. And I would say that that's for two reasons. One, Jill and Vanessa have done a lot of training for community partners on helping them understand the complexities of the program so we can get more people to the resources quicker and in an easier fashion. And then also just the significant increase in the level of need, the cost of living over that same time period. So part of it is self-driven. We are trying to help our community partners understand what some of the eligibility criteria are and how you get onto the program. And then part of that is just driven by the increase in cost of living.
So what is the percentage of participants who are actually on food assistance, the percentage of those who could be on food assistance, the participation rate? I think there's another term for it, but I can't remember.
Eligible but not enrolled.
Thank you.
We don't have access to that data anymore, unfortunately.
Why not?
It was provided from federal partners in FNS in the Department of Agriculture is where the data originates. And then the State Department was able to manipulate it to continue to provide it manually. And then there's just a complete loss of the data. So we take the numbers and try to assess based on what we're seeing in terms of poverty in our community. But it is really a guess of how many people.
It seems like, I recall a couple of years ago when we had those percentages, and I don't know, Hunger Free Colorado was helping to provide some of that. We were pretty low, or we were like a little over 50%. I may be making that up, Heather, but
We
I'm
were
wondering-
only, so at the time the data was available is when we had about 12,500 households that we were serving. We were only hitting, I think, 35 to 40% of those that are eligible and enrolled. So we had a 60 to 65%
who were eligible
gap.
but not enrolled.
Yes, who were eligible but not enrolled. And at the same time, we've seen the numbers of individuals available that are eligible for other programs increase. So even though we've seen a really significant increase in enrollment, I think the total population of individuals that are eligible has also grown. So we might not be a whole lot higher, unfortunately, than 40 or 50%.
Thank you.
To me. Okay, so I will go next, and I'm going to do the AAS Ombudsman tab. I know. Oh, there you go. Perfect. There you go. I know, right? In front of everyone, you get to do that, Kayleen. So I mostly just wanted to highlight here that last fall, the Ombudsman team went through a transition of data system at the state level and how cases and complaints were counted. So more just to show that there's been a change in how we're sharing this data with you, and to make sure that you know they are still doing a tremendous amount of work. So you'll look at the 2023 data on the far left and that gold bar. Complaints previously were counted in if I called with a concern about a facility and I had 3 concerns, that was 3 separate complaints. Where now, if you look at those gold bars in the other 2 graphs, that would just be considered 1 complaint, regardless if there was 5 concerns or 1. So it's just being counted differently, and that's what we wanted to share with you all. Their work continues to grow, as you probably have seen. There's a lot of facilities that are being built here in Larimer County, long-term care facilities, and this mighty team of 4 just continues to do a great job out there. So their criteria hasn't changed as to what they work with or their response to those facilities, but just how that data is collected. So we just wanted to call that out for you all.
FAD Division Manager for Child, Youth, and Family. Let's go to the OOH, out of home. Child Protection Placements, maybe is what it's called, sorry. Yeah. There it is. No. Yeah, the CYF placements go up, right? Nope, just went past it. No. Right there. And I can't even see, like, it's like, oh, where am I seeing? So, and the reason, part of the reason why I wanted to highlight this is, and Heather actually mentioned it earlier, so you see the child welfare allocation, looks like we're getting an increase every year. That's not new money to do new programming, it's new money to do the same programming, is what I would highlight it with one addition. In that the daily rate for foster care across the board, QRTPs, all those placements have continued to go up. So in essence, they give us more allocation to pay for the out-of-home costs that we're doing, not to pay for the in-home cost to serve families. So I just wanted to call that out. But and the reason I wanted to connect this one is the kinship bill 008 from last year. There's a huge population that is not showing on this graph that is kids that are in a kinship setting, in a kinship home, that are not in our custody, but are in either the temp custody or the parent-approved placement with a kin provider. And so the reason that matters is that in 008, there is now funding to be able to support those families that don't get certified. So in essence, it's a non-certified placement. Certification requirements are really high for kinship families. So this bill helps to provide some level of support to those non-certified kin, and it's only a fraction of the daily rate. And so the reason I wanted to highlight that is a couple things. You'll see in this graph, our use of congregate care continues to be really low. We have one child in the QRTP in the state right now. So we are just not using residential. The challenge is we have two kids that are in basically subacute hospitals. One child, we've contacted 160 placements out of state that have not accepted this child. So we are paying $2,000 plus a day to manage these children in out-of-home care. So even though it looks like we have a nice bump in allocation, those things go away real fast when you're paying $2,200 a day for a child. And it's because the high acuity crisis is real, and we only use QRTP when it's essential. So we're still, even though we're probably on the good end of most high acuity crisis compared to other counties, it is still real. And then we have about 90 kids in kinship care that don't show up on this graph because they are not in our custody. So federal government defines out of home as in the custody of the department. But they are in the kinship setting and not living with their primary caregiver. And so at this point, we are at 67%. If we count all that together, we're about 67% of our placements are in a kinship setting, which is about 25% higher than any other county that I'm aware of in the state.
And then, so if you'll go to.
Heather, can I just ask a quick question, or Thad?
Yes.
Couple questions. 76% in kinship care also equates to better outcomes?
Yes,
So
ma'am, absolutely.
that's showing, I mean, is that higher than any other county, and is that showing with our outcomes as well?
Yeah, our outcomes are really strong, and there's plenty of research out there about the long-term positive results of kinship. Kids get back to home faster. They find permanency faster. They don't come back into our system. Yeah, absolutely.
So the two subacute care and trying to find, we're not alone in this, but there's one, two famous cases around the state that I think were maybe even more cost, but I'm just curious, is Colorado the only state that's having this, or is it nationwide? So is this also kind of a federal need to address as well as a state need? Or, I mean, because really this is not just one county or one state. This seems to, I hear about stories across the whole country, but I'm just curious about, is there any states who have exemplars of how they figured this out, or any ideas, any roadmap that we could try to explore?
Yeah, I would say the one that we should be modeling after, and we didn't really get the legislation hoping last year, is New Jersey and their systems of care.
Okay.
And so that they've become very fruitful in how they serve really high complex behavioral health situations. The reality is most states are competing with each other. I want to send kids out of state because I can't find a placement in state. Well, they're sending kids to our state because our state will take their. It's
And they
just
put a
not
big
making
pile of
sense.
money in New
That's right.
Jersey. But I'm curious, the bill that we passed, the high acuity bill, what's the bill number and how is that going to help the situation? Or will it, or do we just?
Can't remember the bill number off the top of my head, but it's intended to grow the number of high acuity placement beds in the state.
There was some
And so-
funding, like $25
yes.
million associated with that. So
Yes.
that will help address to some extent this crisis?
It will help address the crisis. I don't think it's helping us get further upstream, though. So it is really focused on increasing the number of beds available and then also increasing the training for the staff that are managing those facilities and their care providers. So it is a very expensive short-term fix. It was $25 million over the next 3 years. While also we're trying to figure out how we'd get further upstream and figure out the entire continuum of the services that's needed.
And I think part of the challenge with that is even if you have more beds, when we get a kid into a bed, they get discharged, kicked out because their behaviors are so escalated, they don't feel like they can safely manage the whole milieu. So if we don't impact the safety of the milieu, then we may be in the same cycle, more beds, but not willing to keep a kid in. So in every failed placement from a child's lens perspective, the impact of their long-term trauma, it's just so compounding that makes it harder for the next placement to even consider that child for their program.
So we are going to go to 2 new slides. So I wanted to highlight these. Gordon Coombs, our Operations Division Manager. We've added 2 slides that actually show you our lobby volume. And so those are, this one, yes. So the lobby traffic and then the lobby reason. So we've just started tracking this in the last 18 months or so for the first time, as we've also opened up the new lobby at 2555 Midpoint. So you can see really what we believe was driving this increase from July of 23 to January of 23 was the change in Medicaid and people having to re-enroll after not having to go through that process for 4 years. And then a slow but steady decline. But in the month of June, for June 2024, I have to look at my notes because my eyes are not that good. 1,679 individuals into our Blue Spruce lobby just in 1 month. So it is still a really significant number that our fantastic Welcome Center team are helping to navigate our services and all of the programs we provide. And then as we've rebranded, if you will, our lobby approach to calling them welcome centers, that team has also gone through a whole lot of training about community resources, crisis response, so that when someone's coming in, they feel more equipped to be able to handle the varying needs and presentation of how that individual might be coming in, and then also be able to help get them to community resources if it's something we don't provide. So we're tracking this. This is just the sheer volume month over month. And then the lobby reasons gives you a little bit more insight into the reason that they're coming in. General questions is oftentimes dropping off documentation, asking follow-up questions to a case that they might already have with us. So there's a lot more detail into general questions, but we've tried to pull out the other various reasons that people are coming into our lobby. And then Gordon and his team take this back and have a lot of conversations to say, is there a way we can serve these individuals differently so that they don't have to come to our lobby at all? How can we expand the access and the ways in which that we're serving people so that they're not having to come to us, knowing that transportation is an issue, knowing that, our outer lying communities in the county, it can be hard for them to get to us. So they look at this and have a lot of additional analysis and conversations that go into this. And with that, I do have a good piece of information, hopefully, at least in a nugget. So Jill's team, Vanessa's team, Gordon's team have been working on a really significant food assistance grant to federal partners to basically create a mobile office. Create an office on wheels that can go into the outer lying areas of the county and help people navigate our services again so they don't have to come to one of our locations. And the grant providers, FNS, Food and Nutritional Services in the Department of Agriculture, reached out to us last week and said, we would love to be able to fund you. Could you trim off this piece of your application and reduce the expenditure amount by a little bit? And so we reworked the budget and gave it back to them. So hopefully in November, we will be able to come back to you and share that we have secured the grant and we plan to fully implement a mobile approach that we've been talking about, I think, for 4 or 5 years. So we're making progress. We're getting there.
Great
So
news.
much more to come.
That is indeed a new and good.
Yes.
Thank you.
So hopefully it comes to fruition and we'll be able to include that in November as well.
That's great. Is there anything else, Heather or team, that you
I
would
don't
like
think
to share with
so.
us?
We do plan to bring we've been doing some great work with CSU, trying to assess the needs for older adults and look at our services in our older adult programming. So we'll be bringing that in November. But happy to bring anything else that you would like. We'll have the department activity report. But if there's anything that you can think of at this point, we are happy to add it to the agenda.
Thank you. Commissioner Stevens, any closing questions or comments perhaps? And then
Just thank you. I mean, obviously, some of the news around the funding is fairly bleak. I appreciate that you guys continue to move forward and innovate and look for grants and do everything that you can to make things run as smoothly as they can with so much financial uncertainty. And so, as I offered earlier, really, however we can help to have those conversations and talk to people and try to influence that, let us know, because we understand the important work that you do in our community. So just thank you, everyone. And, I think I'm glad we're able to end with some good news. And I think that really is good news. It shows the power of innovation and persistence in staying with a really good idea. So thank you.
thank you. Commissioner Shadrack McNally.
Great, thank you for ending on great news. That's fantastic news, and I know you've worked very hard and diligently, so congratulations and thank you for your perseverance. I know these systems are very complex and complicated, and I just want to thank you all for some great numbers, and not all great news, but I know a lot of that is out of your control. So, I just appreciate you. We've always, I know a lot of my colleagues say this, but this is one of the biggest things that counties do, is just serving folks in need. And the thing I might be curious about, especially with the Office on Aging or some of the other non-government agencies or nonprofits that support us, that are looking, that we, like through Office on Aging, that we use, I'm just curious if they have numbers to their grant programs about how their numbers have increased and their needs have increased, but also their expenses increased. I think that also might be great for us to have, so we understand it's kind of a compounded issue, and then maybe when we're talking with our federal partners, we have some of that information. If it's not, I don't want to be burdensome on those agencies, because we're all feeling, kind of trying to apply for grants and all the stuff, but I think that might be interesting information to have, to kind of add to. It's not only us, the people that we're trying to partner with to do this work are having the same issue. So I'm just curious about that, especially with some things like the Farm Bill and some other stuff, just some things we've been trying to really advocate for. So just curious about that. So thank you very much, and just appreciate always, you guys always share some interesting stuff for us to think about. So thank you.
Thank you. We can certainly follow up on that and bring what we do have in November as well.
And if you could also extend our appreciation to Vanessa and Gordon, who are not here. And just looking at the pictures of this, they're nice pictures, especially the puppies. So thank you for your good work. Lorenda, do you want to close us out with a couple of pearls?
I wish I could stay more positive, but the budget meeting for this department is Friday. And I have to give you all tremendous credit. When Heather says they've had difficult discussions about what they can do and what they must do and how they can continue services, this is not something they just started recently. This has been going on for months. They've been looking at this for over a year, seeing this coming, understanding the state's issues, understanding the county's issues. And I want to give you a lot of credit. Their hearts are in this work, so I can imagine when you say difficult, it's with all capital letters, because none of these are easy things to choose, what to do more of and what to do less of. So thank you for the commitment there. I know we'll have another difficult, not very uplifting meeting on Friday, but I do trust that you all know your constituents, you understand what the needs are, what the funding looks like, and I'm looking forward to kind of helping through that. This is not a human services problem, this is a county problem. This department serves the people in our community who have the greatest need, and so it's about trying to figure out how to balance that.
Thank you.
Thank you, Lorenda. Thank you, team, for being proactive.
Can I make one more, just really quick? Before, I apologize. Before we reconvene in November, we will be sending you all an invitation. So we have tried to continue our all-staff meetings each year where we bring everybody together at the ranch. This year, Thad and Vanessa and our Equity, Diversity, Inclusion, and Belonging Committee have been working on a poverty simulation. So we are actually going to convene and put our entire department through a poverty simulation of what is it really like to live in poverty and how do you access what you need. And so we will send an invitation to you all if you want to stop in, if you want to come for the whole event, you're welcome. That'll be before we convene in November. So we will get the date to you today, and then we'll send you the formal invitation as soon as we have it.
Excellent. Thank you for that. And at 3:26 p.m., we are adjourned. Well done, 4 minutes early. Congratulations.